Hi guys, my name is Al Hoffman. I am the founder and CEO of Luv Health Company. It was Luvia, and we created another parent name for it. Luvia is one section of it now. But I'm going to go ahead and share my screen. Make sure I can go. Yeah, and it went away. Let's see here. Okay. So Luv Health Company is a trusted platform for individuals to connect with highly vetted sexual wellness resources, support, and care. So kind of the problem that we're looking to solve, just kind of go over a few of these numbers. 1 out of 4 women will be sexually assaulted in their lifetime. Alaska actually has a much higher rate than that. I think they are at 59% of women will experience violence in the state of Alaska. 20% of women will experience a sexual pain disorder. 30% of men and 43% of women will also suffer from sexual dysfunction. And in the US total, we have 20 million cases of new STIs each year. And then we have a total of 110 million currently affected individuals in the United States. So the problem with resources, we have unqualified resources between the lack of data and our medical schools not teaching sexual medicine. We have poor access to care and treatment options. The shame around sexual health and wellness is still prevalent today. For people to even have these conversations with professionals is a struggle, and vast majority of professionals won't even start that conversation. Lack of access, currently because it is not taught in schools, your gynecologists, urologists are not sexually medicine qualified. They have to search for or go into that specialty after med school. And there's some great organizations, but it has to be a self push. And then incomplete care. So a lot of the sexual wellness and health issues that we face really need a multidisciplinary approach. If individuals are lucky enough to find a qualified professional, they're likely going to be put in one silo, whether it is gynecology, pelvic floor therapy, sex therapy, etc. So Alaska has some bigger challenges than the rest of the country. Alaska's rate statistic is 4 times higher than the rest of the country, and it's only increasing. So from 2017 to 2018, it's increased 11%. The resources that are accessible in Alaska, due to the location and the rural area, it is a lot harder for the citizens of Alaska to access that qualified care. And then Alaska also has one of the highest healthcare costs in the country. So Luv Health, like I said, mentioned before, connects individuals to vetted sexual health and wellness resources, support, and care. We do that with 3 different platforms. Each has their own focused demographic to continue to have specialized care and a safe space. So Luvia is the women's focused platform. Luvi, which will be launching here soon, is our LGBTQ platform, and Luvo will be launching in the future, and that is our men's focused platform. So our solution is one, trust. Our medical board advisors, who are well respected in the field, have created our vetting process to ensure that all of our professionals and products are safe, qualified, and compassionate, and building a network of these professionals and the individuals that are needing them, as well as the products themselves. And then accessibility, whether you are in Alaska or if you're in Cincinnati, the time that it takes to get to the specialist is time consuming. People have busy lives as it is already, and typically is a further drive The other thing with this is a lot of the sexual health issues are you could put them somewhere under the category of chronic. It's not going to be a one visit to a physician to be fully healed. It's a long journey. So our product, like I mentioned before, we vet the professionals and the products through our vetting process that's been developed by our medical board advisors. The engagement part is a huge critical component. So vetted professionals can upload their content and interact with the Q&A platform to educate individuals and build relationships. That will help tackle the shame and the taboo that prevents many from seeking out professionals. It'll make the professionals seem like real people and not a far-fetched concept. Telehealth will make it more accessible and it will become more affordable is our goal. Not only does Alaska have the highest healthcare costs, most insurance companies do not cover vast majority of sexual health and wellness issues. So people are having to pay out of pocket. By providing telehealth, we can cut the overhead on a lot of the professionals, allow these professionals to see patients in a more efficient and comprehensive manner. The other tool that we're going to work on building out is an employee benefits package and offering that for large companies and hopefully small businesses in the future to supply that benefit for their employees. And then data. So we are significantly behind in data compared to the rest of the medical industry. We have very little research and we have very little treatment options. So we have a goal of becoming the largest database of sexual health research or data, so we can go into better research in the future and develop better treatment options. That is completely to the individual's discretion. If they do not want their data anonymously collected, we will not collect that. So our team is myself, our CTO and co-founder, Dylan. He is absolutely a rock star. Heather Jeffco is a pelvic floor specialist, and then Dr. Gonzalez is a urologist that focuses on sexual medicine, so pain disorders and dysfunction. Kind of our high-level needs. We are not raising yet, but we hope to be raising before the end of the summer. Media, we do not have the same advertisement capabilities that a lot of other companies have. Social media does not allow our type of industry to advertise on Facebook, Instagram, and so forth. So we have a few barriers to get ourselves noticed to the public. So any media resource is definitely needed. And then talent, tech talent is always needed, sales and marketing when we go to raise our round. The other thing I want to mention is I have another company, the sister company of Luvia, that we believe would have a strong impact in Alaska as well. So Alaska also has the highest rate of domestic violence. Luvia has a nonprofit that is called the Healing Link. We are getting ready to launch our capital campaign at the end of the month. The mission of the Healing Link is to build supportive communities to end domestic violence and empower victims into survivors. High level, we are working on building out a program that will start out in person on 244 acres that will combine a strong focus on healing and career coaching and training. It will be between a 14-month and an 18-month program. And then they will have 2 tracks to pick once they meet with the career coach. It will either be entrepreneurship, and we will use our network to ensure their success, or they will go the technology route where they will learn how to code and product development. And we will partner with technology companies to ensure that they have employment. Luv Health Company will also become a company that employs domestic violence victims. So that is kind of high level. I don't know where we are on time, but I wanted to kind of get that in. Domestic violence and sexual assault has a huge impact outside of just the victims themselves. It is basically the heart of almost every society issue that we have. It creates higher crime, Mass shootings, gun violence. So 54% of all of our mass shootings in the US are a direct result of domestic violence. But most of the experts in that field feel like that number is skewed on the low side because it doesn't contribute or doesn't add in the fact of the same individuals that are performing the mass shootings. If it doesn't have to do directly with their victim, then that was not included. So they could still be domestic violence abusers, and that number have not been included into that percentage. As far as poverty, that has a very high statistic. 50% of all homeless women are homeless because of domestic violence. Young children who grow up in homes have a much significant higher rate of becoming abusers themselves. So we're tackling a lot. I believe that if we can build the supportive communities around that and really dismantle the systems around domestic violence, then we can make a huge impact across various other issues. We'll be running a bunch of campaigns to break the silence. That's the other issue, is that domestic violence has still remained behind closed doors. The Me Too movement did a lot around sexual assault and harassment, but the numbers, the rate of domestic violence is the same, if not more, than assault, yet we do not talk about it as a society, and there's still a lot of shame and judgment around the victims. So we are working to bring that issue to the forefront and start to have people talk about it. So that was kind of it in a nutshell.
Well, thank you, Elle. And you asked a little bit about time. We actually have quite a bit of time left. It's about, in Alaska, it's 1:16. I wanted to just open the floor up. I do have a couple of questions. So I have a statement and then a question. One is that obviously you're doing something very courageous. You're taking on a huge lift, an important problem that you're trying to solve. And my question is entrepreneurially. Can you tell us a little bit about your journey? Do you have competition? Like, what have you learned through this process about trying to launch a business?
Yeah, so I guess probably 3 years ago, I had what I called my quarter life crisis. And I left the equestrian industry and decided I wanted to solve the sexual wellness and health issues. And I started a nonprofit. Through that journey, I learned a lot of the different issues that the industry was facing. And I also became aware, educated on how technology was able to solve that. So LSF, which was the foundation, Ladies Pharaoh Foundation, then became Lube Health Company, and we became a C Corp. So that was a big transition. I spent several years learning the nonprofit industry, and then all of a sudden I had to learn the for-profit. We do not have a ton of competition. We're right at the very beginning of that bell curve. Sexual health and wellness has started to really gain its voice. The industry is growing at a huge rate. We expect by 2026 that the industry will be, there's various numbers, so anywhere between $26 billion and $37 billion industry. We have one direct competitor, and that is All Bodies. We still feel like we are vastly different. They have one platform for everything. They are also with reproductive, which it seems as of right now, they are a little bit more focused on the reproductive side than the sexual wellness, and they're also more focused on just women. We have plans to scale across all demographics, but we also are remaining very focused on the sexual medicine side. They do not have the high level of the vetting process that we do. Theirs has been kind of just collective, and they've formed it themselves, where we've had our medical board advisors really, they've been the ones that have formed the entire thing, and it's been all them. The other thing that makes us different is they're curating their own content and then just having professionals prove it or overlook it. Our platform is really geared to creating the relationships between the professionals and the individuals, because that's a huge barrier in individuals seeking help, is that lack of that relationship building. With the content and the Q&A, we're able to not only educate them, but really build those long-lasting relationships and bring a voice to the professionals and not just it be a profile. We really are reinforcing the engagement where they are more content and then search for provider. I don't know if they're looking down the telehealth line or if they're looking into data and so forth. Right now it's professionals and products.
Okay, well, Elle, that's very, very complete. We have one question asking where you're located, and then I'd like to maybe quickly answer that, and then anyone else, please ask a question. We are kind of quickly coming up against time. So where are you located?
Yep. So we're in Cincinnati, Ohio.
Okay.
And the nonprofit will be right south of Lexington in Lancaster, Kentucky.
Okay, wonderful. Are there any questions from the audience that are participating right now?
I have a question. This is Kim. I was curious if you have marketed, I'm just thinking about Alaska and how referrals get made or connections. And I wonder, do you work through primary care physicians who might want to refer, or OBGYN who might want to refer people? And is that a network that we might be able to share this with, or kind of what's your experience been with that?
So we just launched privately to professionals only. So once we build out strong enough traction and we begin to onboard the individuals, we're looking in several different ways. One is definitely forming relationships with primary care providers and other focused organizations, women's health. There's a lot of women's health nonprofits that are out there and tapping into those markets. So yes, we are looking at that. We are not ready for that just this second, but we will be looking at that in the future. So those connections would be absolutely wonderful.
Great. Are there any other questions from people on the call?
It looks like there's another chat question asking, what telehealth platform are you using?
So we are still haven't 100% decided. Right now we're leaning towards TalkBox, which Maven Clinic uses, which is a similar platform as ours, but they're focused on maternity and getting women back into the workforce.
Great. All right.
Now, this is Charlie. Is the importance of telehealth the verbal communications, or do you also need video?
We'll do video. We'll also do a chat version where they can text almost back and forth once the app is developed. But the telehealth video component will be a valuable resource in that communication. It's just a better communication method.
And it seems to me that the victims would probably go to the police or to an ER or a clinic on first contact. Are you planning on trying to get referrals from those other first contact points?
Yes, so we'll definitely make our services known to those officials. The other thing that we look at it though is rape and assault is still significantly underreported, and victims going to the police force or the ER even is still a really big challenge. So the way that we look at it is if we can focus on healing the victim, providing safe and not invasive connections and healing, then maybe we can get women and victims of all demographics to report their cases before the statute of limitations is up.
So when you were sharing your presentation, you were telling us about your Kim brought up maybe connecting you to local women's clinics or to healthcare clinics and things, and that obviously we'll be able to do that. To me, have you thought about piloting this project in a specific location, or what is your test as you move forward to try to work out some of those issues or kinks?
Yeah. So we were going to be very focused on and do state by state. The way that the market's moving, we decided against that. So we are, as we launch to professionals, we are a little bit more focused on the Midwest. So we have professionals onboarding right now from Kentucky, Ohio, DC, North Carolina, and Tennessee. Those have kind of been our focused areas. We're also doing a little bit more focused on professional categories. So right now we have been a little bit more focused on the therapist side of it, and sex therapists in general. Then our next route will be going into the pelvic floor therapists. So we're going to do a little bit more industry expertise. The way that it's onboarding and the way that we're working with professionals, so eventually professionals will be paying a subscription fee per month for our services or our product. Right now we're doing a 1-year free subscription just because we have to build out 2 sides of the marketplace. So it's going to be a little bit more of a mass onboarding for the professionals, and then just working on that engagement and going from there. The problem is with the 2-sided marketplace, and this is another reason why we decided not to do siloed areas, is that when you open it, and if we start doing marketing in any broader sense, whether it's a podcast, whether it's a blog, so forth, we do not want individuals getting on and there not being anything for them and them hopping right back off. So we're taking our time, making sure that we get the professionals on the platform and engaging, and then we'll go on to the second market, and we're giving ourselves a runway without charging the professionals at all to achieve that. The other thing that we're offering the professionals, and I forgot to mention, is that we have, right now it's just a Slack channel. If it goes over well, then we will incorporate it to be a part of the platform, but it is a space for our approved professionals to communicate together. So think of like a conference that they meet once or twice a year, and it's siloed in the industry that they're in.
Mm-hmm.
This is a space where they can engage, they can network, they can discuss new research that's been developed, new treatment options that are there. They can work with helping referrals because they'll have strong relationships as well. So that's another piece that we're offering. So we're really just focused on just the professionals at this point, and then we will open it up to the public.
So, well, Elle, I want to say we're at time now, but what I want to say to you is thank you very much for your time and for presenting. I'm super excited about what you're offering. And I think what we'll do is keep thinking of where we can use this in Alaska. As you saw from the statistics, we definitely need something like this here. And so we will follow your journey and keep you in mind as we move forward with HealthTie. So thank you very much for your time.